to give us the opening address. Over to you, Honorable Minister.
Thank you very much, Foster, and good morning to Deputy Minister Dr. Dhlomo, DG, Dr. Crisp as well, and all officials from the Health Department, our panelists, Dr. Wasila Jassat and Dr. Michelle Groom, NICD, Professor Glenda Gray, President of South African Medical Research Council, Professor Linda Gale Becker, all the media, viewers, listeners, and good morning to all South Africans. I hope many of us were able to have some rest and enjoyed a peaceful and safe reunion with family and friends during the festive season, and that those who went on holiday managed to have a good break. But certainly, as it is always the case during this festive season, many of our citizens lose their lives, and this was the case also this time with a lot of road crashes. Very tragic indeed. We just had yesterday a very tragic accident on the N1 towards my province where more than 17 people perished in one crash. We pass our condolences to all the bereaved families. Exactly 4 weeks ago, on the 17th of December 2021, was the last time we spoke to the nation. At that time, the fourth wave was engulfing the whole country, rising steeply in 8 provinces while showing signs of decline in the Gauteng province where it had started, and also indicating that it had reached its peak in Gauteng. Our biggest fear at the time was the inevitable movement of people in mass transportation, in buses, in taxis and trains, and also social gatherings that could fuel super spreading events all over the country. The trends over the following weeks all over the country followed that of Gauteng. We indeed saw steep rises of infections on a daily basis with high positivity rates of between 25 and 30%, and even above that on a daily basis. Fortunately, the pattern of highly reduced severity as borne out by low hospitalization rates, including less use of oxygen as a therapy and less high use of high care and ICU also continued in the other provinces. We did say at the time that we're hoping that what we're seeing in Gauteng with less severity while the numbers were rising would continue. And indeed, fortunately, that pattern continued in the other 8 provinces. Even more encouraging was that the fatality rates also continued to decline, even though it's still regrettable that we lost hundreds of our citizens during the course of the last 4 weeks. As the Omicron variant has been spreading to various parts of the world, the pattern seems to be the same. Our panelists were just discussing that earlier before we started, with less severity compared to previous variants. With the variant now, the Omicron variant, having been identified in 149 countries, as on the 6th of January, identified by the WHO, as compared to 76 countries when we last spoke on the 17th of December 2021. Notwithstanding the reduced severity overall, the Omicron variant is still very deadly, especially for people of advanced age and also people with comorbidities, and as we will see later on, also for the unvaccinated. In South Africa, in the first week of 2022, we have seen a 13.9, almost 14% reduction in the number of new cases. In this first week of January, there were 46,680 cases compared to the last week of 2021, where we had 54,191 new cases. In the past week, the Western Cape had the highest number of new cases, followed by KwaZulu-Natal and then Gauteng. All other provinces accounted for only 11% of new cases. There has been a 4.8, almost a 5% reduction in reported deaths over the last 7 days. As of yesterday, the 13th of January, there has been a 27% reduction in new cases compared to 7 days before, on a national scale, and the reduction was in all provinces in terms of new cases. There has been a 6.3% reduction in hospitalization compared to 7 days earlier, even though 3 provinces, that is in Mpumalanga, Northern Cape and Western Cape, did report some small increases in the admissions. The national recovery rate, also very encouraging, now stands at 94%, and current active cases as of yesterday, 106,883, which is a 22.7% reduction of active cases compared to 24 hours earlier. The positivity rate of tests has gone down from the highest, as I've mentioned, in the middle of December of 25 to 30%. Also in the last week of December. Currently, as we reporting of yesterday, this has gone down to 14%, which is still high. We want to get down to less than 5%, which will indicate stability. Hospital admissions were rising in the middle of December when we gave our last update, but have been declining steadily. Overall admissions to hospitals over this 4th wave has been much lower than the previous 3 waves. We did indicate this trend, and it has continued. Thus, the term which our medical scientists have coined of decoupling between the steep rise in infections, which is not accompanied by similar rise in hospitalizations and ICU and deaths. Similar pattern has been observed in relation to fatalities. Gauteng province has officially exited the 4th wave in terms of the technical definition of a wave. Gauteng, we can now say officially that Gauteng has technically exited the 4th wave this week. And all other provinces have reached their peaks. All 8 provinces have reached their peaks and are now on a decline. Of note is the fact that the decline in new infections is not a steep decline as was the incline. So this virus rises steeply, but when it goes down slowly, but at least it's going down, and this is encouraging. We must emphasize that the 4th wave is showing unequivocally the protection of vaccination against severe illness and death. We are today unveiling an additional tool on the dashboard of our reporting, in addition to our daily reporting, which shows very clearly the correlation between those who are unvaccinated amongst the hospital admissions as compared to those who are vaccinated, including those in high care in ICU. And an elaborate presentation on this will be done by Ms. Melanie Volmarans later on. Our vaccination program has struggled over the festive season. As we reported on the 17th of December, all provinces took steps to improve access with mobile and pop-up sites at places such as toll gates, roadblocks, and shopping malls, and even at the beach fronts of Durban. The uptake of these opportunities were not as big as we had hoped, as people focused on their festivities and their leisure. After a near total lull between Christmas and New Year, the vaccination rate has picked up slightly, but it's still below 100,000 doses per day, which is not good enough, so we hope that we can be able to push it higher. As of close of business last night, 28.7 million doses of vaccines had been administered to a total of 18.4 million adult individuals, which translates to 45.5% of all adults above age of 18 having received at least 1 jab. Those who are fully vaccinated stood at just under 16 million at 15.9 million, which constitute 40% of our adult population. The leading province in terms of vaccine coverage is currently the Free State province. Congratulations to them at 54.1%, followed by the Western Cape at 53.6%, Limpopo at 52.2%, and the Eastern Cape at 50%. Those are the 4 provinces which have passed the 50% coverage of the adult population with at least 1 jab. 3 provinces are next, with the Northern Cape at 47%, the Northwest 44%, and Gauteng 42.7%. At the bottom of the ladder, it's Mpumalanga at 39.5%, and KwaZulu-Natal at 39%. Last night, Gauteng crossed the 8 million doses administered, which is a significant milestone. The challenge for the Gauteng province is just that they're dealing with a very huge population. Almost 1/4 of South Africans are found in Gauteng. So despite administering 8 million doses, that has only covered 42.7% of the adult population, but a very good performance. As we are aware, vaccination has opened for minors between the ages of 12 and 17. And in this group, just over 1 million doses have been administered. Already 73,000 have already received their second dose as after administering only one dose. The 2 doses were subsequently approved by the regulator on the basis of new information that the severity of adverse effects was really, the myocarditis was found not to be a major factor as initially reported. We have done very well with the over 60 plus cohort, with just under 67% vaccinated, with some districts in the country actually surpassing 75% of the over 60s. The 50 to 59 stands at 62.3%, and the 35 to 49 stand at 50%. The lowest coverage is our biggest cohort, which is the 18 to 34 years of age, which is still at 31.6%. As you know, we have also opened up for boosters for the general population following the Sisonke 2 boosters for health workers. And these boosters have now been opened for the general adult population, with Pfizer 3rd dose being available after 6 months of your second dose, and the J&J 2nd dose being available after 2 months of your 1 dose of a J&J vaccine. So this is now available. People just have to check their last dates of the 2nd dose of Pfizer and the 1 dose of J&J. 6 months for the one, that is the Pfizer, and 2 months for the J&J. Then you can present yourself, even if you have not received a message, to your nearest vaccination point. You'll get your booster. Our main priority then nevertheless remained the full vaccination of all adults, at least up to 70% coverage. I wish to reiterate that the protection of vaccines against severe illness is uncontested, as we can see with the 4th wave, and also as we saw the protection of health workers and educators in the 3rd wave. Thanks to our collaboration with the private sector and the Solidarity Fund, we have sufficient capacity to provide vaccinations to all adult South African citizens. They just need to present themselves and they will get their jab. We will unveil plans to provide more opportunities for vaccination in the next few weeks, and also increase our communication campaign to try to convince more South Africans about the benefits of vaccination. The issue of vaccine mandates is also under discussion, and further announcements will be made by government at the appropriate time. Again, I wish to thank and appreciate the sterling work done by all our health workers under difficult circumstances, including the high load of trauma casualties during the festive season. Let us do our best as citizens to protect our health workers by vaccinating, by also observing health safety measures, but also by not drinking and driving. I wish to conclude by saying that to all South Africans, that 2022 can indeed be a better year. It's all in our hand. We have seen that while we cannot predict the future trajectory of the COVID-19 virus and its variants, but learning from the way we have been able to deal with the 4th wave and the protection of vaccines, the future does look brighter if we all do our best, that is to be vaccinated. We can get back more of our lives, social life. More people can get to work. More businesses can be able to operate at full capacity. We can get more of our sporting, our recreation, and all our entertainment back. But the door to enter that normal life is vaccination. And again, I want to urge all those who have not yet vaccinated to come forward and receive their jabs. Thank you very much.
Thanks very much, Honorable Minister, for that message as far as the vaccination is concerned. There's a saying that when one door closes, another one opens, and we should not allow the next door of fifth wave to open so soon. We can prevent that by taking vaccine and complying with the COVID-19 protocols. So on that note, without wasting any time, I'm going to call upon Dr. Michelle Groom from NICD to give us the update as far as the epidemiological report is concerned. So without wasting any time, I'm going to hand over to Dr. Michelle. Over to you, Doc.
Thanks. Good morning, Honourable Minister, DGs, colleagues and members of the media. So just a quick update in terms of the global situation. And you can see that Omicron, although was initially detected in Southern Africa, has rapidly spread across the world, with many countries, almost 150 now, detecting Omicron. And as you can see, some of these are really just in countries that are not conducting sequencing. So I think this variant in particular has spread really rapidly. And I think just in terms of the global numbers, you can see compared even to the previous kind of global waves, how there's been this tremendous increase in the number of cases, particularly driven by increases in Europe and the US. But I think just to note that this is also just based in terms of, as we know, case numbers are always based in terms of the number of tests that are done. And I think extensive increases in testing as well, which may be accounting for those numbers. So in South Africa, we've similarly seen just how Omicron has now dominated all of our sequences. This was the Beta variant that decreased, was then the Delta. And you can see now just almost 99% of our sequences that are now are caused by Omicron. And so you can really see how rapidly this variant has overtaken from the others, with very, very low proportions of the other variants detected at the moment. In terms of the global, in terms of South African number of cases, just over 3.5 million. And obviously these are the laboratory confirmed cases, and we know are an underestimation of the true number of infections in South Africa. We reached our peak in terms of the 7-day moving average in mid-December. And as the Minister mentioned, we saw this very rapid increase in case numbers and a little bit of a slower downslope in terms of the decreases. But I think really saw a little bit of a dip in terms of that Christmas week, where case numbers were a little bit lower, saw a little bit of an increase over the last 2 weeks, but persistent decreases in terms of the 7-day moving average. Just in terms of the provinces, the third wave had a lot of diversity in terms of the way the provinces presented in the third wave, a little bit more consistent this time with this rapid increase in all of the provinces, followed by a decrease, although still slight differences in the timing. And so you can see Gauteng was the first province to start, the first province to reach their peak, and has now exited the fourth wave. Slight increase you can see in leveling off in most of the provinces this week, with Gauteng showing a tiny increase, 2%. So I think it's more just in relation to slightly increasing testing following the Christmas period, and now starting to see those persistent decreases in case numbers this week. In terms of age, I think also we know there was a lot of concern at the beginning of the fourth wave in terms of the increases in numbers of COVID in children. But you can see really that in the under 10-year-olds, the incidence has remained the lowest out of all the age groups. And so while in the under 5, slightly higher than what we've seen in previous waves, still low incidence. I think just to note that the increased incidence compared to other waves in the 20 to 39-year-olds. So you can see that was higher. Whereas we've seen this kind of decrease in terms of the overall incidence across the waves in the elderly, and also just reflective in terms of this is the age group which has the best vaccine coverage at this stage. And similarly for your 40 to 59-year-olds, you can see there's this decreasing trend in incidence. So I think just showing how important we need to increase our vaccine coverage in those younger age groups as well. As the Minister mentioned, Gauteng has officially exited the fourth wave according to the wave metrics that we've been using for previous waves. In terms of testing, a slight increase in testing this past week, I think just as people have headed home, but persistent decreases in the percent testing positive. And so you can once again see this rapid rise and percent testing positive actually reaching the highest level that we've seen during this pandemic, but a sustained decrease. There was a 6.5% decrease from the last week of 2021 to the first week of 2022, and it's down to yesterday we had a positivity rate of just over 14%. So consistent decreases there, and you can see in all the provinces over the past 2 weeks that we have had decreases in the percent positivity, and you can really just see the spread over the last month, you know, from the northern parts of the country down to, you know, where the coastal provinces were relatively spared. You know, then we had these periods when there was high positivity everywhere, and now, you know, where Gauteng and the northern eastern parts have now returned to lower positivity rates, followed by the other provinces. I just wanted to show, this is the percent testing positive, the 7-day moving average, just to show some of the provincial differences. And I think just to note, Gauteng was kind of the first province that started with the fourth wave, reached a high of just over 40% in terms of positivity, and is now kind of decreasing consistently. And you can really see the other provinces that started thereafter. And so you do see this progression in terms of the positivity rates by province, and then similarly just slight differences in terms of when they peaked. But you can really see in the last 2 weeks we've had this consistent decrease in terms of the positivity rates. Also by age, I think just interesting, as the wave progressed, you can see that initially the wave was predominantly in the younger age groups. I think you can see your 20 to 29-year-olds initially had the highest percent positivity, and your 30 to 39-year-olds, 10 to 19-year-olds, those kind of peaked and decreased at the beginning, started decreasing with a peak in early December. And then you can see your older age groups picked up a little bit later, peaked slightly later, but that all age groups are decreasing. So you can see, although we had this higher percent positivity in the younger age groups initially, overall, you can see, you know, quite similar peaks across the age groups in terms of overall positivity rates, and really encouraging that everything is coming down. So I think Omicron is really dominant in all of the provinces at the moment, almost 99% of the sequences. We have seen sustained decreases in the case numbers and percent positivity, but really, you know, the coming down, the decreases are not as the same rate as we saw in terms of the increases. We've had a slight increase in the number of tests in this past week, but the percent positivity has continued to decrease in all provinces. We've had slight differences in the timing of the waves in each of the provinces, but cases seem to have peaked in all of the provinces and are decreasing. And then we also had these slight differences in terms of the age distribution as the wave progressed, with the spread from younger to older age groups. So I'm going to stop there and hand over to Dr. Jasat to just share the hospitalization and death data.
Good morning, Honourable Minister, to all of my colleagues and to the media and those listening out there. I'll be giving you an update on the fourth wave across South Africa using the DATGov hospital surveillance data. So the first set of slides I'd like to share just shows you the declining admissions in the fourth wave and the decoupling in terms of the cases and hospitalizations and deaths that we've seen in the fourth wave compared to the previous waves. And so this graph shows you admissions in grey, cases in black, and deaths in red, and that's a 7-day moving average for each of those. And what you can see in the fourth wave compared to the previous wave is what we've been terming the decoupling, which means that in the previous waves, we saw admissions and deaths rise in proportion to the rise in cases. But in the fourth wave, while we saw a peak in cases higher than what we saw in the third wave, the peak in admissions was much lower and the peak in deaths was much lower. So what this shows you is that while we had a huge number of cases in the fourth wave, we didn't have as many hospitalizations and deaths as compared to the previous wave. Just showing you the incidence risk of hospitalization by province, by week. You can see what was also a bit different in this fourth wave is that while the previous waves had a different evolution, starting in one province, moving to other provinces, and a long protracted wave over 2 or 3 months, this wave was very tight. It started in Gauteng, but within a week spread to all the other provinces. There was a sharp increase, a sharp peak, and all provinces started to show a peak and a decline around the same time. And as you can see, all provinces have consistently shown decreases in hospital admissions over the last 2, 3, or 4 weeks. Again, show you more data that demonstrates decoupling. This graph shows you the 7-day moving average for cases, admissions, and deaths in the fourth wave as a percentage of the third wave Delta peak. And what you can see is that the cases peaked at a higher rate than the Delta peak. Admissions peaked at about 60% of the Delta peak, and deaths peaked around 14 or 15% of the Delta peak. What's also encouraging is that we're also seeing a decline in the weekly excess mortality reported by the South African Medical Research Council. On the top, you can see the excess deaths for those under 60, and you can see over the past 2 to 3 weeks, we've seen decreases in the excess mortality. And the bottom graph shows those excess deaths for those over 60 years. And we haven't yet seen a decrease in those over 60 years, but we are starting to see a plateau. And as Dr. Groom showed you, the rise and peak in cases in older people was a bit later than that in younger people. And so we hope to see a plateau and a decline in the excess deaths for those over 60 as well. But besides that difference between the age groups, what's also very striking is that even using excess mortality, we didn't see the rise in deaths as we did in the second and third waves. And so this fourth wave really did not see a huge rise in excess deaths, along with the sort of lower levels of reported COVID-19 deaths. So now some data from on severity in this fourth wave, and some of the data is updated from a preprint that we've submitted to the Lancet. So this table shows you a comparison of the full waves of the first, second, third, and fourth waves. Now, the median length of stay was shorter in the fourth wave compared to the previous 3 waves. The percent of cases who needed oxygen was lower at 22% compared to the previous 3 waves. The percent of cases who were treated in ICU was 5.8% compared to 15, 12, and 14% in the previous waves. The percent of cases who had severe disease was 31.7% compared to proportions of 52, 63, and 63% in previous waves. And the proportion of admitted patients who died in hospital in the fourth wave was 9.7% compared to 21.5% in the first wave, 28.8% in the second wave, and 26.4% in the third wave. And these graphs just show you the similar comparison between the waves. So you can see there was a lower proportion of cases admitted in the fourth wave, lower proportion required oxygen, lower proportion had severe disease, and a lower proportion died. So the other data I wanted to share was around admissions in children in the fourth wave. And so very early in the fourth wave, there was a lot of concern because we saw a big number of admissions in very young children. So this is a comparison of the 4 waves across the entire wave period. And for those over 20, you can see that the percentage of cases admitted to hospital in the first wave was 13%, second wave 14%, third wave 12%, but in the fourth wave was 7.2%. So there was a lower percent of cases admitted to hospital for those for adults. Amongst children under 20, the percent admitted of cases admitted to hospital was 4% in the first wave, 4% in the second wave, 3.8% in the third wave, but 8.4% in the fourth wave. So there was a higher percent of cases admitted to hospital in this fourth wave in children compared to adults. And just looking at that another way, when you compare the 4 waves, you can see that in the fourth wave, there were lower proportions of admissions amongst the total admissions in those 40 to 59 and over 60. But in those under 20 and 20 to 39, they made up a bigger proportion of the total fourth wave admissions compared to what we saw in the previous wave. So there was a trend towards younger people making up a bigger proportion of admissions in this fourth wave. However, all indications are that the severity amongst younger people was also lower in the fourth wave as compared to the first, second, and third waves. And finally, just some data around vaccination, and just want to reiterate that this is self-reported vaccination data that's collected in our DATGov hospital surveillance, and it's not through linkage from the EVDS, and so it's therefore not complete. But we looked at the percentage of admissions and deaths that were unvaccinated in this fourth wave across South Africa. And you can see that we had data available for only 26% of all admissions, but the vast majority, 82% of admissions, were in unvaccinated individuals. It was much higher in younger people where vaccination rates are lower, up to 90 to 100% in those under 40. It was a bit lower in older people where the vaccination coverage is a bit higher and where they probably received their primary series of vaccination a number of months ago and are due their booster doses. On the right is the proportion of COVID-19 deaths in the fourth wave across South Africa who are unvaccinated. We had data for 32% of deaths, and similarly, about 82% of the deaths occurred in unvaccinated individuals. And so just striking the important note of the importance of vaccination. I've included a slide which I won't go through, but I'm happy to share these slides through Foster with all the media. But this is just a summary from the WHO technical briefing of all the evidence that we have from studies around transmission, pathogenicity, severity, and the impact of Omicron on immunity. And finally, just to summarize our own data, we are seeing a decline in cases and hospitalizations, and what is looking like a slower down wave compared to the very rapid up wave. In the fourth wave, we've seen a decoupling of cases, admissions, and deaths, and we did not see a breach in the health capacity in the fourth wave, despite having no increase in national restrictions. We're consistently seeing a decrease in severity and deaths in the fourth wave. A lower proportion of patients needed to be admitted, lower proportions of patients needed oxygen, ventilation, and treatment in ICU. But in children, while we did see an increased proportion of admissions, of the total admissions in the fourth wave, we did not see any increase in severity or death even in children. And again, just to make the point that most admissions and deaths for those individuals we had data for were in unvaccinated individuals. Thank you so much.
Thanks very much, Dr. Michelle Groom and Dr. Wasila Yasat on that update as far as epidemiological report is concerned. Without wasting any time, I'm going to call upon Professor Glenda Gray, who's supported by Professor Linda Gale-Baker, to share with us the findings of the Sibongiseni 2 trial, as people always ask us about the effectiveness or the importance of booster shots. So they want to share with us the findings of Sibongiseni vaccine effectiveness. Over to you, Prof.
Thanks, Foster. Good morning, Minister, Deputy Minister, DG, DDG, and all my colleagues, all protocol observed. I'm going to present this on behalf of Linda Gale-Baker and myself, who are the two national co-leads, and together with Nigel Garrett and Amina Gogo, who are also the who represent some of the leadership in the Sibongiseni 2 study. So just to give you a summary, of the roughly half the people that were enrolled in Sibongiseni 1 got boosted at around 236,000 people, and mostly were in the Gauteng and in the Western Cape province. We will be tying up the Sibongiseni 2 protocol, and so we hope that everyone will see that how good the data is and encourage people who've had the single dose of the adeno or J&J vaccine get boosted. So as already Michelle Groom and Wasila have shown, even in the Sibongiseni study, we did see a decoupling or delinkage of cases to hospital admissions. And this just shows you as a percentage of the delta, you can see, again, the infections in the Sibongiseni mimic what has been seen in the general population. Overall, in the Sibongiseni study, we've had around 51,493 breakthrough infections, 11,586 during beta, 10,625 during Delta, and just under 30,000 during the Omicron period. And we saw that the daily infections during Omicron were 3 times that seen in the Delta peak, and are clear decoupling as we've seen in the general population. If we have a look at the admissions, in the Omicron period, we see more females, but this is a reflection of the healthcare workers in South Africa. Most of the healthcare workers are female, but we also saw that they were much younger people. So again, mimics the same kind of what we saw in the data that's been shown in DATCOV, is that much younger people were more likely to be admitted, and because of Gauteng being the lead province, we saw more people in Gauteng being admitted into the hospital as compared to the Beta and the Delta periods. If we have a look at, as I've mentioned before, more likely to be younger people, more likely to have HIV, and less likely to have other comorbidities as compared to the Beta and Delta period. So very important, to look at vaccination rates in HIV-infected people and to make sure that people who are HIV-infected get vaccinated, because we know that they're more likely to have adverse outcomes if they get COVID and they are infected, and particularly if those are not on antiretrovirals or immunosuppressed. So very important to make sure people who are HIV infected in our country are taking their treatment and have their regular boosts. In terms of the characteristics, again, like we've seen in the DATCOV data, is that the healthcare workers were less likely to be in ICU, less likely to need ventilation, and less need for oxygen as compared to the Beta and the Delta period in South Africa. So also very encouraging data from the Sisonke 2. In terms of vaccine effectiveness, we're very excited that we saw great protection against hospital admission in our healthcare workers. And so this slide just shows you, as we followed up healthcare workers who were boosted and looked at the durability of the vaccine. So in the healthcare workers that had been boosted just between 0 and 13 days, because your immune system is evolving, we saw 63% protection against hospital admission. In those who had been boosted between 14 and 27 days, we saw an 84% vaccine effectiveness. And we see that this kind of vaccine effectiveness is maintained beyond up to 2 months. And so we are refreshing this data, but very happy to report very high levels of vaccine effectiveness against the Omicron in South Africa. In fact, this is the world's first evidence of vaccine effectiveness with using the J&J vaccine and demonstrating high levels of vaccine effectiveness. And just to show it in a different way, you can see the buildup of your immune response between 0 and 27 days, and then a maintenance of vaccine effectiveness beyond that. And as I said, we'll be refreshing this data again to see whether the durability is contained. So just very good, exciting news to encourage people who've had the single dose J&J to go and get vaccinated. We have real world evidence from South Africa that this vaccine protects and is very durable. There are other data that we're looking at in the laboratory that shows great protection, a lot of cross protection against Delta if you were vaccinated, and you also got the Omicron, saying a lovely cross protection to other variants. So very important to get your vaccination and to show the durability of the J&J vaccine. So when I always thank everybody, particularly the South African government, this is a collaboration with the Department of Health, and without the funding from Treasury and the NDOH, we could never do this work, as well as the collaboration with the EVDS and the national vaccine rollout. Without them, we couldn't do this kind of study. So we just want to thank everybody that have been involved, and just people who've worked very, very hard with us to get this data. And just thank you again to the DG and the DDG for all their support on this. Linda, I'm not too sure if there's anything else that I've missed that you want to just talk about going forward.
All good on my side.
Thanks.
Wonderful. Thanks to the two professors, Professor Linda Gray and Linda Baker, for sharing the findings as far as Sisonke 2 study is concerned. Without wasting any time, I'm going to call upon Dr. Nicholas Grace to share with us the update as far as the vaccination program is concerned. Over to Doc.
Thank you very much, Foster. Good morning, Minister, Deputy Minister, DG and colleagues. What I would like to do is just show the changes in the public dashboard and give some quick highlights on the numbers. The Minister's already given them in the introduction, but we are approaching 29 million total doses given. And you've seen the daily breakdown, the provincial breakdown of those doses. From last night, the dashboard is now showing booster doses, which is a positive change in the dashboard and making it possible for reporters and people who are interested in following the separate information. There's more disaggregation in the data, and that was the main thing I wanted to show. So that was in the last 24 hours, and you can see also in the total number of vaccines that were administered, also the booster doses are illustrated separately now, and you can see the first and second doses separately on the graphs. It's early days in the boosters still, as we opened up for booster administration only in the Christmas period. So the major total booster doses that you've seen is this 236,669, which is amongst healthcare workers. Just to illustrate those who have access and see these graphs often on the internet, this is the general trend of each province of the decrease in the daily vaccination and weekly vaccinations we're seeing. We dipped now during the Christmas period quite badly, as the Minister said, but we're already starting to see a recovery of the vaccination program, and we hope that as the vaccination sites come up and people get back to work of their normal lives, we will pick up, as we have seen from the presentations so far, and you're going to see just now from Melanie Wolmerans, the impact of vaccination on everything we do. So this is the challenge that we have. It's amongst the younger population between 18 and 34 and 35 and 49, where both men and women are not as well vaccinated as we need to protect them from severe illness and being admitted into hospital. So although the numbers look quite big, as a proportion of those total populations, we are not doing as well as we need to be. The total number of individuals vaccinated per week, one can follow this on this screen. This is the adult population over the age of, excluding the 12 and 17-year-olds. And the total number of individuals vaccinated now exceeds 18 million. Still a long way to go to the 40 million. And the breakdown further, I won't dwell more on this, the total adult population again, where you can see that the population is just under 40 million. There's the 18 million that we are trying to reach, which is the 45.58. But we want to emphasize, and you're going to see it in a moment when Melanie presents, that it's the older populations down here on the bottom right-hand corner of this slide, where over 60 population across the country is 66.56% are vaccinated and 62.38%. And if the previous presentations have shown us, this is the population who has had the least impact in Omicron, and largely because there's been such good vaccination coverage. In some districts, that coverage is already over 75%, as the Minister said. This was already presented, so I'm going to skip that slide. And this is also just another way of showing each of the four major age groups that we are concentrating on. We are now trying to increase the target or the vaccination to up the targets in the younger age groups, because we're very happy with the vaccination in the older age groups, where we just want to encourage people to come for their boosters. And I've shown the boosters. So just this is pretty much the same information. The fully vaccinated, you see the same sort of layout. 16 million people have been fully vaccinated in the adult age groups. That's just under 60% now fully vaccinated, and we're moving into the booster campaigns. You will now be able to see separate sheets for the 12 to 17-year-olds first and second doses, and you are able to see also on this screen the number of booster doses on a separate sheet. So I'm going to stop presenting here. Thank you very much, Foster, because it's more important that we see the new sheets that are going to be incorporated, and Melanie is going to take us through that. Thank you very much.
Thanks, Doc. I'm going to hand over to Melanie to take us through the new changes as far as dashboard is concerned. Over to you, Melanie.
Good morning, and thank you, Foster. Good morning, Minister, Deputy Minister, DG, colleagues, members of the media, and everybody that's listening. So I just want to confirm that you can see my screen.
Yes, thanks.
Okay. I'm going to take you through a navigation of the page that will be added tonight as part of the publication of the vaccination data that we publish every evening on the SA Coronavirus website, as mentioned by Minister in the introduction or into his introductory remarks. So this is the page that will reflect hospital admissions by vaccination status. It's important that you look at the date when you look at this page, as we are sometimes experiencing a delay with regards to the .gov data. So this specific page is looking at the linkage between those that are admitted and that are reported by all the hospitals on the NICT.gov and link that with individuals' vaccination status. And then the analytics are being done and presented in the specific page. So if I can quickly just orientate you on the details of this page, it's containing quite a lot of information and it's completely interactive, and I will try and take you through that. So first of all, the first bar at the top will give you information around the total number of individuals that is in hospital, and just the total number of people that's in hospital with COVID-19. It then breaks it up in terms of vaccination status. So on the far left, it will give an indication of the number of people that's not vaccinated that is in hospital. So of this number of 7,826 individuals that's in hospital with COVID-19, 5,731 of them has not been vaccinated. 321, this is the middle block, is those that has not been fully vaccinated. So in real terms, that means that they've only received one dose of Pfizer. And it's also related to the timeline post-vaccination, and I'll explain to you that just now. And then if we look at the far right, then that gives an indication that of the 7,826, 1,774 were fully vaccinated. Then it further breaks it down to indicate how many of these 5,731 that's admitted in hospital that were not vaccinated. 4,976 were admitted in a COVID ward. 359 was admitted in high care, and 396 were admitted in ICU. And then similarly, the data are being disaggregated to include the of those that has not been fully vaccinated. 262 were in the ward, 22 in high care, and 137 were in ICU. If we then look at the fully vaccinated, 1,406 of the fully vaccinated were in the ordinary COVID ward, 114 in high care, and 228 were in ICU. So all of this data then are being presented in graphical form at the bottom. If we look at the first stack graph, then it gives us an indication of the sex distribution between the admissions. The red is the unvaccinated, the orange is those that are not fully vaccinated, and the green is those that are fully vaccinated. So if this is the sex distribution between the two, male and female, and then we also have a group that we do not have the information. So if you hover with your mouse over the stack graph, it will also provide you with the details that you are looking at. The next stack graph indicates the different age groups. And here we can then specifically look at the age group of the 60 plus, where we can see that of the admissions of those that 60 plus, 247 were not vaccinated, 156 were not fully vaccinated, and 997 were fully vaccinated. If we look at the far right, in terms of the little people here, this you need to carefully look at the legend at the bottom. This is just to indicate the proportion in a pictorial form in terms of those that's not been vaccinated, which is the red, those that it has been vaccinated, which is the green, and the orange are those that has not been fully vaccinated. As I've indicated, this is fully interactive. It's possible to select a specific province. I'm just going to select the Western Cape. And then everything on the specific sheet will change to give you the details for the Western Cape. It's possible to select multiple filters, so we can specifically look at in a ward. Then everything will change to give you the data to say that at the ward level in the Western Cape, this is currently the information around those that has not been vaccinated, those that's not fully vaccinated, and those that are fully vaccinated. It's also possible to look at age groups. So if we look at the 60 plus population, then everything will then again change to provide us with the information around the 60 plus population. So if we now look at what is presented to us in front of us, then of the total number of individuals that's admitted in the Western Cape with COVID-19, 594 is 60 years and older. Of the 594, 326 have not been vaccinated at all. 27 has not been fully vaccinated, and 238 is fully vaccinated. And then we can see that of those that are fully vaccinated in the 60 plus population, there's nobody in high care and nobody in intensive care. All those of the 60 plus population that's fully vaccinated, that's admitted in hospital, is admitted in an ordinary ward. It's also possible to then look at the different sex in terms of male and female, and it's also possible to, at the top, just select, for instance, fully vaccinated, and then the whole slide will update again. So we trust that this will provide more information to the public and the media in terms of vaccination status of those that have been admitted in hospital, and it actually presents us with a clear picture that vaccination is a defense against COVID-19. Thank you very much.
Thanks, Milani, for that update. We believe this will assist us to limit the volume of media and public inquiries, and will also assist the people with access to information in order to make well-informed choices. Thanks for that presentation. We believe this will be live immediately after, or it's already live, I believe. It's already live as we speak, so that people can be able to access.
Sorry, Pastor, just a correction. It will be published tonight at 8 o'clock when we publish all the other dashboards on a daily basis, and it will be updated daily. Thank you. Okay,
thanks very much. So without wasting any time, we are now in that moment of question and answers to respond to a number of questions that we've received. So far, we've received about 15 questions from members of the media. I'm going to break this into two rounds. I will take the first batch of questions, about 10, then we'll take the second batch. Minister and members of the panel, the first batch of questions read as follows. Question number one, I know, just to clarify, I know some of the questions have been answered on the chat, but for the benefit of those who are watching on TV, following through other channels of communications, I'm going to read these questions so that the members of the panel can assist to clarify them so that everybody will get answers. The first question reads as follows. I need clarity regarding the quarantine and isolation period on the 23rd December, these regulations were changed, and then a week later, the decision was made to recall. However, when the Department of Health calls patients, the contract on, in fact, when the Department of Health calls patients, they tell contact not to quarantine, and the persons who are ill must isolate for 8 days. This is creating confusion. So, in short, this is related to the circular that we issued on the 23rd of December, and later had to put it on hold a few days later. So they just need clarity on that. Second question from Sumen Naidu, a freelance journalist. Can the department provide an update on considering a proposal by the Department of Basic Education to reduce social distancing in schools? Third question, there are some calls for full-time return of students. Is there any early indication by the department when the fifth wave will hit South Africa? When will the fifth wave hit South Africa? The fourth question, is the decision to lift the curfew did take place at our healthcare system under any pressure, or were they able to cope? Is the decision to leave the curfew had any impact on the health system? Were the health facilities under pressure, or were they able to cope? The fifth question from Luke Daniels from Business Insider SA. What is the new targets for the country's vaccination rollout? Initially, 70% of the population, or 70% of the population was due to be vaccinated by the end of the year, and this target was then pushed until the March this year. Currently, 40% of the adult population is fully vaccinated, which puts the country far off March targets, with daily vaccination having never reached the present target of 300,000 per day. So clarity on that. The fifth question, the president has put a lot of emphasis on this target, alluding to lockdown being lifted in its entirety once the target or the herd immunity has been met. Is the country's program still regarded as feasible key to ending the lockdown? If not, what now needs to happen from a public health perspective for lockdown to eventually be lifted completely and the state of disaster revoked? The last two questions from Rian Brothwell. What legislation or other legal mechanisms is government considering around lifting the national state of disaster while keeping the COVID-19 restrictions in place? Is there a time frame as when the state of disaster is expected to be lifted and replaced with COVID-specific regulations? The last question from Aisha from Wall Street Journal. This is directed to Dr. Groom and Dr. Jasad. Are there any longer-term conclusion about Omicron being assessed currently, and what can be said about the level of defense that prior infection provides against Omicron? I'm going to read the very last question before I hand over to Minister and the members of the panel. Are the PCR tests still required for entry to enter the country for fully vaccinated citizens? Are the PCR tests still required in order to enter the country for fully vaccinated citizens? I'm going to stop here and hand over to Minister and members of the panel to respond to these questions. Over to you, Minister, and the members of the panel.
Okay. Thank you very much, Foster. I'm trying to quickly allocate. I'll deal with the first one, the one on basic education. On the first one, I'll start, and DG can add. On the second one, I'll ask Dr. Crisp to respond to that. The third one calls for any indication about fifth wave. I think on that one, possibly our colleagues from NICD could comment. Maybe Professor Klenda can also venture into the fifth wave. I'll leave that to the scientists. That is number 3. Number 4, about the targets. I think if I'm not mistaken, Foster, 4 and 5 are very close to each other. And in log, yeah, I'll deal with 4 and 5. And then number 6, also on amendment of legislation, I'll deal with that. Number 7, okay, that's specifically to colleagues from NICT. I think number 8, DG can, together with Dr. Crisp, can deal with PCR test required for entry. I think the two of you could handle that one. Just on the first one, it is true that there was a circular and then which was withdrawn. This circular was as a result of advisory from our Ministerial Advisory Committee. The substance of it, therefore, we agreed with. The only reason why the circular was withdrawn temporarily was to deal with some matters which needed further consultation. Some of it within government, there were a number of matters which we needed to align with other provisions of the Disaster Management Act. There needed to be further consultation, but also just to allow other members of society, if there were any other comments. We're almost done with that. So, but because the substance of what has been advised by the Ministerial Advisory Committee, we were in agreement, including reviewing of the periods of quarantine and how to deal with the spreading and so in practice, that's why you will find that the health facilities would have been already implementing some aspects. But to clear up the confusion, in the next 7 days, we should be able to come back to the public with the situation properly clarified. We are done almost with the alignments and the consultations which needed to be done. But I want to emphasize that the body of substance had never been at question in terms of what we had been advised. So there are just a number of areas where we needed further input, and that has now been done. And we're able to, reformulate. There will be minimum changes, but because of the fact that we needed to align also based on inputs and also on regulations arising from the disaster management, which also we had to make sure that there is that alignment. So that is on course. So that I don't come back, Foster, let me deal with 4 and 5. So that I don't have to come back, which have to do with the targets. Let's just say basically that in my introductory remarks, I did say that our target is still informed by population immunity or herd immunity. Which has to be coverage of between 67 and 70%. So that remains of our target in terms of the adult population coverage, at least 67 minimum and up to 70% of the adult population to be vaccinated. Now, that is why when you look at the preparation in terms of supply and in terms supply of vaccines, how the number of vaccines we acquired through purchasing, and also the capacity which we created to vaccinate the sites, the personnel, and all that is available can reach. We could have reached this 70% by the end of December. Where we fell short is in convincing the population to come forward and receive the jab. At least 45.5% did come forward, at least for a jab, and 40% for a full vaccination. So we are short by 30%, not because we didn't create the capacity, but we are lacking in terms of the messaging, reaching the people and convincing everybody who is eligible to come forward. So that's why in my remarks I did say that we are still going to do everything we believe is possible, and we appeal to all South Africans who agree with what we are trying to achieve to free the country from the clutches of COVID-19. We invite everybody, the media, all leaders of society, who can bring fresh ideas in terms of the issues which we need to respond. What are the things which still make people hesitant, so that we can respond to those? So we're putting some effort to get deeper into those issues so that we can be able to reach the 70% of the population. So that target, we have to do everything to make sure that we can reach that target, so that the country can ultimately have a chance to go back to normality, socially and also especially in the economy. So if we do that, because we don't know what further changes in the virus and in its severity, in its virulence, and in its transmissibility. So we must do what we can to manage it. And doing so, as we have seen during this fourth wave, we have managed from the experience to really balance between lives and livelihood. Not much of severe harsh lockdowns. We've managed, and if more vaccinations happen, then there will be even less need for that. The president has put emphasis on targets. I think I've dealt with that. And if again, just to say that if we can cover more people, then there will be less need for even some of the restrictions. And then, of course, lastly, the question was whether legislation of other legal mechanisms considering. Yes, we are. The health department and also justice and COGTA have been given the task by cabinet to look at other regulations, largely Health Act regulations under the Health Act, and also any other under the other departments. So there's a team which is almost also finalizing that. We will be going to NCCC and cabinet in the coming week, or in the next 7 days. We should be able to report and make proposals. And depending on how far this can cover all the requirements to assist society in preventing super spreader. If we can find other mechanisms, and the team, our expert teams are looking at other mechanisms, when that is agreed, but we are not going to simply rush under the pressure of those who are saying do away with the disaster, because the disaster is not really because we like it. It's simply a measure currently to protect the country and its population. So we are busy working on this. Cabinet has given us very clear instructions. Our teams are working, and they will be reporting in the next 7 days to NCCC and cabinet with some proposals which must be interrogated. If they are found to be adequate enough, there will be some adjustments which the president will be able to announce at a future date. Let me then hand over to other members. I think I said on number 2, if Dr. Crisp, and then together with the DG on the PCR for traveling. Over back to you, Foster, then with that kind of allocation.
Well, Health Minister Dr. Joe Phaahla, they're saying we cannot predict the future trajectory of the COVID-19 virus, but as it stands, reduction in almost all the indicators, including a 4.8 reduction in reported deaths. The recovery rate stands at 94%. Gauteng province has officially exited the fourth wave. All other provinces have reached their peak and are now on a decline, and saying that last night Gauteng passed the 8 million doses administered of vaccinations.